8:22 on your Monday morning. It's Meredith with you. You're watching Breakfast Television. And as we make our way through January, many are thinking about kind of a personal reset, one of them being facial rejuvenation and tweaks with neuromodulators. And it's important, really important, to have the right information before moving ahead with any of those treatments. So, facial plastic surgeon at Form, Face and Body, Dr. Michael Brandt, joins us this morning. Welcome to BT.
Thanks so much for having me.
Lots of great information that we're going to get into because, people are interested in this, but there are ways to kind of go wrong. So we're going to allow people to sort of make the right choices here. Neuromodulators, what are those?
So, a neuromodulator, best brand name that people are familiar with is Botox. So, what they are, it's an injectable treatment that helps stop muscle movement. By doing that, helps correct fine lines and wrinkles. It can prevent them as well. That's sort of the basic idea. The analogy I usually use with patients is if you stop wrinkling the sheets, eventually they lay flat.
Right. And good to know, too, that Botox is a brand and not the actual thing, because I think people make those confusions. Besides the neuromodulators, there are also something called fillers. So what are the differences between those two?
So fillers and an injectable volumizer. You can think of it as sort of injecting in a cushion or scaffolding to help restore sort of volume or structure of the face. So it just provides, little rejuvenation of the lips or cheeks or the nose.
And if people are looking to get work done, they've established, like, okay, I'm kind of curious about this. Step one, how do they kind of know which they're maybe better for, or what age would you suggest people start looking into this?
So the best thing to do is to find a good practitioner. Okay, so the analogy to use is, if all you have is a hammer, then everything's a nail. So people can't be fit into a little box. It's best to seek out people who have a whole volume or wealth of different tools that they can use to make you look your best, and then they can come up with a good plan to treat you that's right for you.
And would you say sometimes too, is it good to kind of talk to, you see people, you sort of talking about, have you done some work, like who did you go to, like if you like sort of someone's work that you see on a friend or a colleague or whatever, is that a good way to go in terms of research?
Yeah, I mean, references are always great. You know that they had a good experience. I think that's important, but I also think everybody needs to research who they're seeing, because you need to have a background. You need to know who you're seeing. You shouldn't be drawn in by a deal or just, somebody saying, hey, this person's amazing, because maybe when you go in to see them, you need something else treated that your friend or colleague didn't have done.
Yeah.
So it's best to sort of get a little background on who you're seeing.
Yeah, and TikTok is not the spot.
No.
Yeah. Dr. TikTok is not where you go. So when we go to see someone for the first time, are we bringing photos? How can we best show up to get the best result at the end of the day?
So if they're photos of somebody else and you're trying to look like somebody else, then no. You're trying to look like yourself, but a little better, right? So that's the idea. If that's helpful, then sure, especially if you're coming in for like a comprehensive assessment for like a facelift or something. Definitely, it makes sense to bring in photos from your youth. But in general, come in and talk about areas that concern you or problems.
Yeah, and sort of stay open to the feedback. What are tips for people that really don't want to look like they've got something done, or that like that overboard look, because that would, I think, keep some people out of the office?
Absolutely. So come up with a good plan. Start slow is the main thing. Don't come in and get 6 syringes of filler done at once, because if you're overdone in one single setting, you're going to regret it. You're not going to be happy afterwards, and then people are going to be like, hey, what did you have done?
Yeah.
Come in and go slow.
Yeah, that's not the question you want.
Yeah.
You look great. You look rested. Yeah. Okay. And the number one mistake people make.
So being lured in by deals is really the big one. So you find I don't even know if Groupon's still a thing, but finding a deal and then being drawn in by a deal, you haven't researched who you're seeing. You need to have a good background on who you're seeing, what they're treating, and make sure they have all those different tools available to them.
And where can people find out more info about you? This has been incredibly helpful information.
Formfacebody.ca.
Excellent. Dr. Michael Brandt, thank you for joining us on Breakfast Television this morning. Lots to learn about this, and he's the guy to do it. More BT coming up after this.